joined now by Dr. Alex Jahangir. He is chair of the Metro Coronavirus Task Force, and we're about to have a conversation about how hospitals are doing.
An important conversation. Dr. Jahangir, thanks for joining us. Hospitals so important, of course, in treating both the sick and injured. Can you talk about the capacity of our local hospitals and where we stand today?
Sure. Good afternoon. So Nashville is a great city in that we have a lot of great hospital systems to take care of a lot of things, not just COVID, right? Heart attacks, trauma, transplants. And COVID has been stressing hospitals all across this country, from Houston and Miami, where they're at full capacity. Here in Nashville, I just checked right before we went on the air, and we have just shy of 20% of our ICU and hospital beds available. But I think what is really important for people to recognize here is hospital capacity is not just the physical beds. It's also really important to know how many nurses and doctors and respiratory therapists are available to staff those beds. And as more people are getting sick with COVID, less and less of those staff are available because they themselves have become ill. So right now in Nashville, we're doing okay, but I do worry because of that exact issue that I just mentioned.
All right, so HCA Healthcare told us today that they are evaluating all of their elective surgeries over the next couple of weeks, and anything not considered urgent is being rescheduled. This sounds familiar to a whole lot of us when this whole thing broke out. So what does a move like this signal to you?
Well, I think that worries me, frankly, because nobody ever just wants to have surgery, right? So if you have a surgery, even if it's quote unquote elective, it's surgery you're going to need to have. And what I worry about, and what we saw when we had this similar thing a few months ago, is conditions became more challenging to treat once we finally opened up our healthcare systems. So I know HCA and Vanderbilt University Medical Center and Ascension and Nashville General are all working hard to try to take care of everyone they can now. And ideally, we'd like to try to avoid that if we can, because people who are sick, and the conditions will continue to worsen if we have to delay. So it does worry me, and it shows also a lot of responsibility from those centers to want to make sure that they're able to take care of the people who maybe need more urgent care. But don't be mistaken that not scheduling the elective stuff doesn't have an implication.
Doctor, one final question. What's the status of those alternative hospital sites? Are we still a go on those?
Yeah, just last Thursday, I went and toured the alternative care site that the state has set up in Nashville General. There's 70 beds that are literally all set to go. They even had deodorant and toothpaste in the bed stand next to them. They're that ready. The one thing that they need is staff, and the state is waiting to staff those. And hopefully, we'll never need to staff them. But we only will need to staff them when our flattening the curve initiatives have failed. Again, that's why I keep saying wear a mask. We as a city have done the certain things that we have done in limiting capacities, but those alternative care sites are ready to go, and hopefully we never have to use them, but if we need to, they're ready to go.
Yeah, and that's assuring. All right, well, thank you very much, Dr. Alex Jahangir, tonight.